Well, thousands of schools across the country are sending kids home to learn as staffing shortages hit districts pretty hard. Indiana is no exception. IPS announced 8 high schools and middle schools are going virtual through the end of the week. Same with Anderson Community Schools. Greenfield Central High School made a similar move, and Heritage Christian is fully closing tomorrow, all because too many staff are catching COVID. Now we have a full list on WTHR.com. After going virtual last week and a half today, Pike Township schools returned to in-person class, but the district says to expect bus delays. And if your route is included, the district says they will let you know. Happening tonight, the Pike Township School Board meets at 7, and we could learn more about the future of Pike Township Superintendent. We'll keep you updated on what happens with that on 13 News at 11. This morning, our Lauren Caustic is digging into the effort to track down school outbreaks.
Since the summer of 2020, a team of contact tracers in Marion County has worked to identify COVID clusters.
It's hard to keep up. I don't think any contact tracing team in the country is keeping up right now.
Shandy Darth says cases can vary from 200 to 600 a week. Plus, her team is a lot smaller now.
At the height of this, we had 200 people. We're down to about 55 right now, but obviously our case count is very high. So we really had to prioritize what cases we go after first.
That means focusing on the cases that impact schools, which includes anyone 20 or younger.
A key piece of information we're collecting right now is what school the child attends.
That way the county can identify any outbreaks.
That's when Dr. Keene and her team can go in and have those conversations about if they need to go remote, maybe some grades or some classrooms. We're really trying to keep the schools open as much as possible.
Here's how it works. When someone tests positive, the results go to the Indiana Department of Health and are put in a statewide database that local health departments can access. Every day, contact tracers look at that data and assign cases.
We immediately, by 9 a.m., we start calling cases. We've learned, don't call too early and don't call too late in the day, but we call those cases to do the case investigation and also to collect any close contact information.
But since not every case is investigated, contact tracers encourage Hoosiers to reach out themselves, especially during this latest surge.
We realize we're not going to contact trace our way out of this. We really need vaccinations and lots of other things, mask use in place.
For now, the team is trying to get through this school year before making any new changes.
Well, the White House has a plan to keep kids in classrooms by expanding access to COVID tests. The Biden administration will provide an additional 10 million COVID tests for free to schools every month. The program targets students from kindergarten through 12th grade. The administration says it also plans to send states billions of dollars to set up testing programs at schools and set up so-called surge testing sites in hard-hit communities. And the Biden administration also says it's ordering another 500,000 courses of the AstraZeneca's COVID treatment. Officials saying the U.S. has more treatments available than at any other point during the pandemic. But 20 million doses of Pfizer's antiviral pill Paxlovid are not set yet to be delivered until the end of June. Now, healthcare workers say they need them now.
Had we had hundreds of millions of blister packs of Paxlovid right now, we'd be able so much better to fend against Omicron. The fact that this was the first medication that was designed specifically against this virus, that I think was worth a shot. It was worth an investment, but there was none.
Paxlovid has been shown to reduce hospitalizations by nearly 90% among those at highest risk for developing severe disease. It's a combination of oral pills that work by interfering with the virus's ability to replicate, but it must be administered within 5 days of symptoms.